Okay, so today we're going to be performing trach care and the trach suctioning on my patient. I'm going to check the doctor's orders, make sure that if there's anything that I need to do while I'm in the room, but I'm going to, we don't suction on a regular basis only when the patient needs it, so that's why I have my stethoscope. I'm going to listen to her. So I come into the room, and this is Miss Sally Sue Johnson, so I'm going to check by her name tag. And it says that she's Miss Sally Sue Johnson. She's 32 years old. I'm going to be talking to her and just explain to her what we're going to be doing today. So I'm going to say, hi, my name is Megan, and I'm going to be your nurse today. We're going to be doing two things. First, I'm going to suction you out, suction your trach, and then I'm going to just clean around your trach. Is that okay? And depending on the type of trach she has, she may or may not be able to respond back. So I'm going to look for nonverbals, maybe get a piece of paper and a pen so that she can write so we can communicate. So since she already has oxygen on, I'm going to turn her oxygen up 4 or 5 liters so that we can hyperoxygenate the patient. I'm then going to put her into a semi or high Fowler's position just to prevent aspiration and to make it easier for me and for her. So I have this set so that it's hyperoxygenating through her trach. I'm then going to come over and wash my hands, and I've been using hand sanitizer and washing my hands throughout this entire procedure when I walked in, before moving the patient's oxygen and such. So next, I'm going to come over and I'm going to grab my suction catheter kit. I'm going to open it up, and this is my sterile field. So I'm going to carefully grab this. Again, I have a 1-inch border around it. And I'm going to dump my little box on there. I'm just going to scoot that out of the way for right now. I'm then going to come in here, open this up. I have about a 1-inch margin. I'm going to come in and I'm going to put on one of my sterile gloves. Making sure only to touch the cuff and to step back so that if it were to drop, then I wouldn't contaminate my field. I'm then going to reach around, grab my box, and open it up using only one hand, and open it down like that. So it'll stay upright. I'm then going to come over and grab my bottle of sterile water. If this were a brand new bottle, I would date and put my initials on there as to what time we opened it. Because this is an already opened bottle, I would lip it, meaning pouring a small amount into the trash can. I don't have a trash can right here next to me, so we'll just pretend we've lipped it. And I'm going to come ahead and just pour a little bit of water into here, making sure that I come in from the side of my sterile field not to break that. And then we'll just close that up, put that back over there. Now I can come in with my second hand and put my sterile gloves on. And at this point I can come in and just rearrange my fingers as I need to. I'm then going to take my trach suctioning tube and I'm going to wrap it around my dominant hand. So just like this, so as to maintain sterile field. We'll throw that away. Go like that. When I go over to the patient, this is going to be my dirty hand, and this is going to be my clean hand. So So I'm then going to scoot this over just a little bit closer with my foot, keeping my hands above my waist at all times. Still and so I'm going to come over, and with this hand, I'm going to remove the oxygen. And then I'm going to connect, making sure that this hand never touches this sterile tubing and that this hand doesn't touch the suction tubing. I'm going to come in, turn it on, and before this I would have turned it to high suction because intermittent suction isn't going to really do anything for us in this procedure. So I'm just going to explain to the patient what I'm doing. So I'm going to enter the tube, enter the suction tube, making sure not to touch her clothing, into her trach, and advance it until I feel some resistance. I feel a little bit of resistance right there, so I'm going to pull back about 1 inch. I'm then, with this hand, going to cover my spout, which is going to give me my suction. I'm going to twist and pull, only suctioning for 10 seconds at a time. Pulling out, releasing, coming over to my sterile water, and clearing my line. And then coming back over to the patient, repeating it up to 3 times in between oxygenation. After I feel that we have adequately suctioned, I'm going to take my gloves off. I'm going to wrap this up into my gloves, and I'm going to double glove it. And then throw it away. And then I would take my stethoscope and I would listen in all 28 spots for the lung clarity of my patient, and then I would reapply the oxygen. Listening to make sure that it's pretty clear. 4 sides, 1, 2, 3, 4, and then all 10 on the back. And she sounds pretty clear at this time, so we're happy with that. If she were to be still junky and congested, then we would get a new trach kit, or we'd get a new suction kit, and we would just suction her out again, making sure to hyperoxygenate in between each time. So I am going to clean up my area, and we're just going to move all of this over here, pretending that we threw that away. So then I have my tracheostomy care kit. Again, just explaining to my patient, okay, we've suctioned you out. Now we're going to go ahead and clean around your trach. So again, I'm going to wash my hands. And if I were coming in again, I would do my entire beginning procedures. But since this is the same patient at the same time, we'll just go straight into it. So I'm going to open my trach care kit. Maintaining my 1-inch sterile borders. I am going to very carefully reach down inside here, trying not to touch anything, and getting my drape out. Scooting that back over, making sure not to touch anything in there. This sterile drape is now going to be my sterile field. So I'm going to make sure to keep a 1-inch margin. We'll set that down. I'm then going to take this, and from the side, I'm just going to plop it on there. And since I broke sterile field on this side, I would then have to go get a new trach care kit, but for the sake of time, we're just going to work with what we have. I'm going to come in and I'm going to grab one of my gloves by the cuff and put it on, just so that I can arrange everything as I need it. Again, I'm going to come over with my sterile water. I would do the same thing as I did for my suctioning. Since this is a new bottle, I would whip it into the trash can. If it was a brand new bottle, I would cyanidate it. I'm going to come over here and I'm going to pour it into my large reservoir, and then again into one of the smaller reservoirs. That on, grabbing my hydrogen peroxide, making sure not to reach directly across my sterile fields, coming over and filling that with some hydrogen peroxide. I would then put my other sterile glove on. And then, again, this is going to be my clean hand. This is going to be my dirty hand. So, coming over here, removing the oxygen from my patient, I'm going to remove this inner cannula, taking this over, placing it in my hydrogen peroxide, letting it sit for just a minute, swishing it around. I'm going to come in and I'm going to grab my brush, which may be a little big for this trach tube, but we're just fine, it fits. But we're just going to clean that all the way through, removing all of that junk that could have built up so that we can maintain a pain airway for our patient. I would throw this away, keeping my hands above my waist at all times, keeping my sterile field in my field of view at all times. If I feel like it needed a little bit extra cleaning, I can come over, take one of my pipe cleaners. Again, I haven't actually touched the trach, so I'm still okay to, with this hand, so I'm still okay to grab things off of my sterile fields. And so I feel that this is adequately cleaned at this point in time. I would throw this away, keeping my hands above my waist. I would then proceed to just rinse this off into my vat of sterile water, because hydrogen peroxide can be quite caustic to the sensitive tissues of the larynx or of the trachea, and so you just want to ensure patient safety and patient comfort. So at this point, it is no longer considered a sterile procedure. It's considered a clean procedure after I have inserted the trach. So I'm going to take this and I'm going to insert it into the trach tube and have the patient either tell me or write that they're experiencing any major discomfort or anything like that. At this point, again, it is not considered a sterile procedure, it's considered a clean procedure, so we're just going to be practicing aseptic techniques. I could change my gloves into another pair, but these are still clean, so I feel okay doing that. So what I'm going to do next is I'm going to come in and just take some of my sponges and I'm just going to wet them in my water. And I'm going to come over here and we're going to gently remove the previous dressing. As I'm removing the dressing, I would be assessing taco, which would be my time, amount, color, and odor of the drainage. That's something that we want to be very cautious of. So I'm going to come in with this, and I'm just going to gently clean around here, stabilizing the faceplate with this hand. Cleaning around there, making sure that you get all those nasties out of there. We'll discard that. I would then have, and I would do that until I felt that the area was adequately cleaned. I then have some Q-tips that again I'm going to dip into the sterile water, come over here, and then doing the exact same thing, just cleaning directly around the site, just to maintain cleanliness, to prevent infection. And just talking to my patient while I'm doing this, making sure that she's comfortable, and where my patient is on oxygen, intermittently. If I notice that she's starting to get short of breath, then I would reapply the oxygen at that point. So I'm going to throw this away, I don't need that anymore. I'm going to come over and I have my scissors, and I'm just going to set those right there. So then I'm going to come in and I have this. You always want to use the gauze provided in your trach care kit, because if you were to cut it, then those fibers can get into the lungs, which is something that we want to avoid. So then I'm just going to come in and we're going to, this is going to be easier if I just cut this. So I'm going to cut this while stabilizing this, making sure that it doesn't move, so that we can the trach dressing up and around here. Making sure that it's completely covering the hole and that the faceplate is still in the correct position. There's that. And so then at this point, I'm going to stabilize it with this hand while I'm doing this side, because we really don't want any excess movement if we can avoid it. I'm going to come over here and grab my new set. Okay, at this point, I'm just going to have to to wrap this around the back of her neck, making sure that there aren't any like twists or anything in my string. And then feed this through the one side, and I will proceed to tie a square knot, making sure to keep her hair out of it. And then I will check for the tightness of my string, because you want it to be pretty snug, because you don't want that trach moving, but you still want to fit about 2 fingers in between the string and the neck. At this point, I would ask her if there's anything that's severely uncomfortable, if there's anything she'd like me to change, and just being open with my patient, communicating, replacing the oxygen. And at this point, I would turn her oxygen back down to where it was before. And I would clean up my area return her to a comfortable lying position, or a comfortable position for her. And then I would go and I'm going to clean up my area, I'm going to document, and any significant changes I would report to her after.